Instrument display. Put the patient on the operating table. Knee flexion of the injured leg, 70 to 90 degrees. Under X-ray guidance, close reduction of the fracture end. Use a retractor or external fixator if necessary. Use a radiometric ruler under X-ray guidance. Combined with the external scale and the medullary cavity imaging, determine the length and diameter of the main nail. Humerus reaming. The entry point is located on the axis of the medullary cavity. Posterior cruciate ligament located at the anterior and lateral femoral attachment points. Through the incision, fit the drill sleeve to the bone. Insert the 3.2 guide pin to a depth of 10 to 15 centimeters. Confirm the insertion position of the guide needle under X-ray. A 13 diameter cannula bit is inserted into the cannula along the 3.2 guide needle. The drilling depth is about 60 millimeters. Remove the protective sleeve, drill sleeve, and guide wire. Insert the reduction rod along the channel for intramedullary reduction. After reduction, insert the olive head guide pin along the rod. Then remove the reduction rod. Start with the smallest diameter elastic reamer and gradually ream along the olive head guide pin until the diameter is about 1 millimeter larger than the nail. Connect the main nail to the handle, ensuring the handle is on the patient's outside. Use the olive head guide pin to rotate and push it. Insert the nail into the medullary cavity and tap it gently with a sliding hammer if necessary. To make the main nail's tail sink into the joint, 2 to 5 millimeters below the cartilage surface. Fix the blade nail guide module to the handle. First, fix the distal 6.0 locking screw. Insert the 6.0 locking nail sleeve assembly. Align the sleeve against the bone. Remove the 4.8 sleeve core. Use a 4.8 drill bit. Stop after drilling through the opposite cortex. Confirm the position of the drill under X-ray. Remove the drill and drill sleeve. Measuring depth operation along the protective sleeve. Select the appropriate length of 6.0 lock studs with the screw grip driver. Screw in the 6.0 lock nail along the protective sleeve. Confirm the length and position of the screw under X-ray. Start to drive the spiral blade. Insert 3.2 guide pin sleeve assembly. Take out the 3.2 sleeve core and drive in the 3.2 guide pin. Identify the depth of the guide pin in X-ray. Make sure the guide pin's shoulder is flush with the inner cortex. Remove the guide pin sleeve. Insert the guide pin side device. Read the depth of the guide pin. Use a hollow countersink drill. Drill a hole along the guide pin. Drill to the bottom with the protective sleeve. Select the corresponding length of the spiral blade. Connect it to the spiral driver. Tighten it. Turn the driver along the handle's guide. Reach the bone surface. Manually or lightly tap the blade nail into. When the head and side of the blade nail are flush, it is the correct insertion depth. Position the compound blade under X-ray. Remove the blade nail guide module. Select the corresponding proximal aiming frame according to the short nail and assemble it. Adjust the aiming frame's orientation according to the left and right legs. Insert the 5.0 mm locking sleeve assembly against the bone surface. Remove the 4.2 sleeve core. Use a 4.2 drill bit and drill through the opposite cortex along the drill sleeve, then stop. Remove the drill and drill sleeve. Sounding operation along the protective sleeve. Select the appropriate length of 5.0 lock studs. Hold the screwdriver with screws. Screw in the 5.0 locking screw along the sleeve. Confirm the length and position of the screw under X-ray. Repeat the above steps. Drive in the second locking pin in the parallel hole. After all, the lock nails are fixed. Use a universal T screwdriver to unlock the handle. Remove the aiming frame. The purple tail cap used with the blade nail must be used. Hold the screwdriver with the tail cap. Rotate counterclockwise first. After the tail cap thread is aligned with the main nail thread pattern, rotate clockwise to fully screw the tail cap into the peg. Replace with a T screwdriver lever. Lock and secure the blade nail. Short nail blade nail finished product display. Refer to the way of the short nails in front. Perform main nail opening, access, reset, pulp expansion, etc. After completing the medullary cavity preparation, select the corresponding length of the main nail. Insert it into the body with the handle until the end of the main nail. Submerge into the articular cartilage by 2 to 5 millimeters. Fix the 6.0 locking guide module to the handle. Insert the 6.0 locking sleeve assembly along the guide hole against the bone surface. Remove the 4.8 sleeve core. Use a 4.8 drill bit. Stop after drilling through the opposite cortex. Remove the drill and drill sleeve. Sounding operation along the protective sleeve. Select a suitable length of 6.0 locking screw. Use a screw grip screwdriver. Screw in the 6.0 locking nail along the sleeve. Confirm screw length and position under X-ray. Repeat the above steps. Complete the screwing of the second parallel locking nail. After distal fixation, remove the 6.0 guide block. Select the aiming frame corresponding to the nail length. Complete the erection of the aiming frame in order. The main nail has left and right legs. When fixing the aiming frame, it needs to be adjusted to the corresponding position. The platform hole aiming frame is on the front of the femur. Insert the platform hole sleeve assembly into the platform against the bone surface. Remove the inner core. Replace it with a 5.2 drill sleeve. Use a 5.2 drill to penetrate the cortex. Replace it with a 5.2 flathead drill to clean the channel and reach the proximal platform of the intramedullary nail. Remove the 5.2 drill sleeve. Insert the positioning rod and align it with the platform. Insert the 5.0 locking sleeve assembly from the side hole. Refer to the method of proximal fixation of the front short nail. Complete the 5.0 locking studs at the proximal end. If necessary, can break the third 5.0 lock nail. The hole is on the side of the platform position. After all, the lock nails are fixed. Use a universal T screwdriver to unlock the handle. Remove the side. Use a gold tail cap. Hold the screwdriver with the tail cap. Rotate counterclockwise first. After the tail cap thread is aligned with the main nail thread pattern, rotate clockwise to fully screw the tail cap into the peg. Replace the T-shaped screwdriver rod and tighten it. Long nail lock, nail implantation, finished product display. Clean the tailbone tissue and remove the tail cap. Remove proximal 5.0 lock. Screw the slide rod with the extraction rod at the end of the blade nail. Then tap it gently with a sliding hammer. Take out the blade nail. Screw the sliding rod into the distal end of the main nail. After the sliding rod is fixed in place, remove the last locking pin. Finally, use a sliding hammer to remove the main nail.